I currently work with Gilson and Aronson, which is an elder law attorney firm. But my prior position was with the Caddo Council on Aging, where I did Medicare counseling, which is where I learned a great deal about Medicare. Not everything about Medicare. I'm not sure anybody knows everything about Medicare. But I can remember when I first started there, I was not working with Medicare. I was working with a veterans program. But we had those offices with they're like cubicles with just partitions, temporary partitions between us. And the Medicare counselors, I could hear everything they were saying. And I would sit there, I am so glad I don't have to know all that. Literally, I did. So be careful what goes through your mind. But I don't regret it at all. I'm very grateful that I had the opportunity to learn all the Medicare information that I did learn. So before we start, I am assuming that most people in this room are already on Medicare.
I'm not.
Not, okay. Not, I know, yeah. And I know Laura's not. Okay. So what are people here mostly interested in hearing about today regarding Medicare? I want to make sure I cover what you want to hear.
I would like to understand the difference between regular Medicare and the Medicare Advantage plans, because I've heard differing opinions on what's what.
Right, and the differing opinions won't go away after we talk about it.
Yes.
Okay. Anything else people specifically want to know about? Okay.
Drug plans, I think.
Right, that's a good one because right now we're moving into the open enrollment period, which starts the 15th of this month. So yeah, that'll be a good thing to cover. Okay, I guess since we have some people who are not on Medicare yet, I'll kind of do a brief overview. So I'm going to give everybody this handout. So, Medicare is sort of an alphabet soup. You've got your A's, your B's, your D's, your C's, but then when you go to your supplement plans, they all have letters too. So, you know, I used to wonder, and I've stopped wondering anything like this anymore because you never can figure it out, but why in the world is everything lettered when they're not even part of the same picture and they just confuse people? So, I don't have an answer other than, in my imagination, when people sat down to plan Medicare, they said to themselves, what can we toss in there to make it really confusing? And then they did it. You know, it's just, I don't know why it's so confusing. It just is. But when you, as you all know, unless you have a disability, you are eligible to enroll in Medicare when you were 65 years old. Yesterday was my first day on Medicare because you enroll, you become a Medicare participant on the first of the month of your birth month, of your 65th birth month. So I had my Welcome to Medicare Day yesterday. You have choices. When you first enroll in Medicare, if you are already retired, you probably need to go ahead and enroll in everything. Unless, and is anybody in here married to or themselves a retiree of federal government, state of Louisiana, teachers, anybody like that? Teacher? State. Okay, so your situation will be quite different. Will you be receiving state retirement benefits, or are you receiving already state retirement?
I am not yet. I'm still not old enough to get them, but I had optional retirement, so it's in a separate account that I have somebody manage for me. So the state does not have my money.
Okay. But can you go on when you become 65? Is your health care currently through the state?
Yes.
Okay.
And I still have that as a retiree.
Okay, so when you reach 65, you have the option of going on to keeping your state benefits, getting your Medicare A and B, and letting your state benefit plan, which is probably Blue Cross Blue Shield, right?
Right, that's what my husband does.
Okay.
Yeah,
yes,
he's already
okay.
on Medicare, so.
Yeah, and so I wouldn't worry about your question of advantage versus
I'm
your.
actually, that I'm asking for my dad.
Okay.
Yeah.
Well, we were gonna cover it
Okay.
anyway, but for you, don't worry about it, 'cause you
Lots of people to,
Yeah.
It's already
Yeah.
complicated.
Yeah, and then other people, like if you're a clergy member or married to a clergy member, there are special, benefits related to that, so, if you're in any of those special categories, your situation's gonna be a little bit different. But if you're, regular Joe Blow and you hit age 65 and you're already retired, then you wanna go ahead and enroll in your Medicare A and Medicare B if you're eligible. That means you worked 40 quarters at least during your, lifetime. You wanna go ahead and enroll. And if you do enroll, your A is prepaid. People say it's free, but you have been having it taken out of your wages all of your working life, so it's not really free, it's prepaid. So you don't have to worry about paying premiums for Part A. However, for Part B, you do pay a premium. This year, 2024, it was and is $174.70 if you are kind of in the middle income bracket. If you are in a very high income bracket, you're gonna pay more for your premium. If you are low income, there are programs to help pay that premium so that you either have it partially paid for you or fully paid for you, depending on what your income is.
What is the median, what is the income brackets?
To get help?
Yeah.
Okay, I've got a handout for that too, which, this actually is a little booklet, so when you get it, if you wanna fold it in half, it makes the little booklet. But I'll talk more about that, later in the program, but I wanna get the information out to you. And I'm sure most of you know that, Medicare A covers your inpatient services such as hospitalization or inpatient rehab, and your Medicare Part B covers your outpatient, medical care such as doctor visits and outpatient visits of any kind, rehab, whatever. Hospice is also covered under Original Medicare. I'm calling it Original Medicare because I'm comparing it later to Advantage plans. And hospice is kind of unique, so even if you're on an Advantage plan, your Medicare is, an Advantage plan is your card that covers everything, but when it comes to hospice, that's the exception. Hospice is paid for through Original Medicare. So you have some options after that. You've got your A, you've got your B. Does anybody have any kind of retirement benefits that include healthcare? Anybody?
Yeah, mine,
Your retirement benefits cover healthcare, you're a retiree of
City of Shreveport.
City of Shreveport, okay. So you're probably gonna wanna tune out a little bit here too, yeah.
It don't hurt to know things.
Yeah, so, cause what's gonna happen is what probably already has happened is your Medicare is primary and your city,
No, I'm not old enough yet.
okay. So when you go on, so your city healthcare is your one and only insurance.
Right.
But when you become 65, do they ask you to enroll in Medicare?
I'm sure they do.
Mm-hmm. You can call your benefits coordinator to make sure, but you're probably right, they probably do. So you enroll in your Medicare, and then you keep your city benefits as your secondary coverage, and that will cover the generally 20% that Medicare doesn't pay. It will also cover your prescription drugs in most cases. So, but you want to check that out through your benefits coordinator as you get closer to your 65th birthday. And you can enroll in Medicare 3 months before your birth month, your actual birth month, and 3 months after your actual birth month, and not be penalized. It won't be late. I recommend you do it in those months before your 65th birthday, because if you wait till your month of or after that, you might have a little gap in coverage. Because and what if you get sick and need coverage during that time?
Yeah.
So I would go ahead and start enrolling in that either 2 months before or 3 months before your actual birth month, so that you've got it in place when your birth month hits. Okay, so you've got your Medicare A and B, and now you're thinking, what next? So you do have choices. Your general choices are staying on original Medicare or opting for an Advantage plan. And I've got some handouts to cover that too.
We love handouts, right?
Yeah. Basically, on original Medicare, that's government healthcare insurance, okay? And if you stay on original Medicare, there are certain things that are not covered that you need to get additional coverage for through the private healthcare insurance companies. So with Medicare only, as you can see by this chart, you do get to choose any doctor you want. I don't know of any doctors that don't take Medicare. The reason easy access to specialists has a stop sign there is because specialists are going to be cautious if you do not have some kind of supplement to cover the 20% that Medicare does not cover. Once you get that supplement in place, you're good to go. Is it affordable on a fixed income? Well, there's the other stop sign because you do have to pay for a supplement. The supplements are more expensive in general than the Advantage plans are. Coverage away from home is good. Prescription coverage, not in original Medicare. That's where your Part D comes in. So what you need to do if you're gonna stay on Medicare, original Medicare, is make sure that you do get a supplement and make sure that you get it along with your Medicare, because when you're 65, you have that opportunity to enroll in a supplement where they can do a health assessment, but they can't deny you because of the health assessment. You can, no matter what your pre-existing conditions are, no matter what your health history has been up to this point in time, they have to accept you, and they have to accept you at their basic entry-level price. So they can't jack your price up just because, you're diagnosed with some kind of lung condition or something. They can't jack your price up. Okay, so it's not usually too horrible in terms of pricing when you first enroll in your supplement. The thing with supplements is that the prices tend to go up. They have these age categories, and it depends on the company. They may be 4 years, it may be 5 years, but once you get out of that little age category and jump into the next age category, there may be a price increase. And also they can, in general, raise their prices, cost of living, whatever. So sometimes it can start out affordable, and then on a fixed income, as time goes on, it's not so affordable anymore. And then once you have your Medicare A and your Medicare B and your supplement, also called a Medigap plan, in place, you still don't have your drug coverage taken care of. So for prescription drug coverage, you need a Part D. Part Ds vary a great deal in the formularies. They vary a great deal in the pricing. In general, they're not terribly expensive. And if you don't have a lot of particularly name brand medications, you can usually get a plan at the base premium, maybe $30 a month or something like that. They're not expensive. They become more expensive if you're on some high cost drugs, name brand drugs. They become more expensive.
Say that again. It's more expensive for what?
If you have some high cost drugs that you need to take that are prescribed to you. The other thing to keep in mind about Part D, we talked about the supplement, and they stay pretty consistent from year to year. If you are on a Plan G, for example, the government, so no matter what your company you choose to provide your supplement, the Plan G is the Plan G is the Plan G, okay? There are government standards that the Plan G has to meet. So really what you're looking at is variation in cost only from company to company. So the best thing to do is to get the help of a broker, an insurance broker, who works with all the major companies so that you're getting the best price. You don't want to, for example, go to a Blue Cross Blue Shield agent, because that agent is only going to show you Blue Cross Blue Shield plans, and you may be opting into the most expensive Part G or whatever part you choose, and you could get the same exact plan from a different company for cheaper. So again, I can't explain the price variation. I mean, I'm sure the companies have their lines about why theirs is higher and how much better it is, but I can't explain it. So I think that people should go to a broker that will show you plans from all the major companies so that you can make a choice that is the least expensive for your needs. Okay, so I kind of diverted there, but anyway, back to Part D. Back to Part D. Part D is not consistent, okay? Part D, if you go to different companies, most companies have several Part D plans, and they're all different from each other in terms of formularies and pricing, and then the companies vary among each other as well. And to make it even more confusing, each year they scramble it all up. So whatever was a good plan for you for 2024 and covered your drugs well, your co-pays were low, may not be the best plan for you for 2025, even though your prescriptions are exactly the same. Now your prescriptions also sometimes change during the year too, so that's another reason to think about, okay, do I need to stay on this plan or get another plan? So that's why we have open enrollment every year. It begins October 15th and it ends December 7th. And that is your time every year to examine your Part D plan that you currently have, compare it to what it's gonna be in 2025 and what the other plans are in 2025, and make the best selection for you. You can do that on Medicare.gov website. There is an enrollment, Part D enrollment program within that is fairly easy to use. It used to be a nightmare, but they maybe about 6 or 7 years ago they made it much more user friendly. You can also call the Caddo Council on Aging and make an appointment with the Caddo Council on Aging. It is free Part D assistance, enrollment assistance. They are very highly trained. They work with the Louisiana Department of Insurance. There's a section of that is specifically for Medicare. It's called SHIP, and they work with the SHIP, the state SHIP officer, and it's a valuable service that very few people know about. They can help with a few other Medicare things too. They can do general Medicare counseling when you first enroll in Medicare. And they can also, the handout that I passed out that tells you how to get help paying for Medicare, they can help you apply for those benefits if you need help applying for those benefits. So I highly recommend their services for any kind of Medicare help. Okay, so with Original Medicare, you've got your A and B, you've got your supplement, your Medigap plan, and now you've got your Part D. So if you look at your handout with the traffic light kind of things on it, you see that once you have all those things, well, this doesn't cover Part D, but once you have these things in place, you've got everything covered except it's not the most affordable option. Okay, so why would you do this? Well, as you can see here, you might do it for choice of doctor, but the other reason you're going to do it is it's portable. You can take it anywhere in the country. Your Advantage plans are located region specific. So, and they also you have to have a physician, whether it's a specialist or a GP, that is in the network, or it doesn't pay. You know, it has to be somebody that's in the network. Also, another reason you might choose Original Medicare is if you can predict your future, and you see that you're going to have some high health needs as you age. Because Original Medicare asks fewer questions. They just pay. Remember I said it's government operated. They don't have personnel that can go into your home or go to the facility where you're receiving care, or call the facility or get paperwork from the facility that says, you know, what's going on with you, how are you progressing, is this service benefiting you? They don't have time for all that. So they just pay. They pay the maximum that Medicare pays, the maximum number of days. If you have an Advantage plan, much less expensive. Some of them have no premium, okay? But they do closely monitor because it's private healthcare. They do have people assigned to monitoring what's going on with their enrollees. Is this rehabilitation keeping them healthy or making them more healthy or not? And if the answer is not, then they stop paying for your rehab before the maximum coverage ends that Medicare can pay. So if you can get your crystal ball out and see what your healthcare needs are gonna be, then it's a very easy choice, because you do want, I mean, you don't wanna be cut off of rehab. I can't tell you how many families get upset by that because somebody else says that mom isn't benefiting from it, and the family's like, but I think she is benefiting from it. You know, I mean, it's just real frustrating. And actually, most rehabs say they have to benefit from it, but legally, they don't have to benefit from it. It can be pure maintenance or prevention of decline, anything along those lines. So, but the companies look at it as, oh, well, they're not benefiting from it. And I know that's a fine hair to split, but it is a hair to split. So, you know, you can fight it sometimes, but that takes time, and meanwhile you're private paying if you want rehab to continue until it's settled. You might get reimbursement, you might not. So it's a real pain if you feel like you need more coverage than what you're getting from your Advantage plan. However, when I used to do this counseling regularly, I ran across people that didn't have anything. They had Medicare A, maybe they had Medicare B because it was coming out of their Social Security and they didn't even know it, right? Because if you're already on Social Security when you hit 65, you just kind of automatically get your Medicare. But they didn't have any supplement, and they didn't have anything really, and no ability to pay whatever Medicare A and B didn't pay. I mean, I ran across that all the time. And what that meant was doctors would turn them down, healthcare facilities would turn them down, because, well, how are you gonna pay for it? 20% of a hospital stay is a lot of money, okay? And unless it was that emergency care that they're required to do in hospitals, because, you know, it's life or death situation, they would sometimes get turned down. So in those cases, I was sending them to agents to enroll in Advantage plans, because an Advantage plan is designed, or was originally designed for people who couldn't afford a supplement. And it does a good job of covering that base that was previously not covered. I also ran across, and I know you hear about the extra services that Advantage plans offer that original Medicare does not offer. And that would include vision help, you know, with eyeglasses sometimes dentures, sometimes hearing aids. And so those are nice little perks, and they throw them in there to attract people to their plans, and it is a nice attraction. But when people are deciding between an Advantage plan and staying on original Medicare and getting that supplement, I think their first priority should be, what are my actual healthcare needs, okay? And decide on the plan. And if you decide at that point, well, an Advantage plan is gonna cover my healthcare needs, or I can't afford a supplement, then you look at those individual Advantage plans for the perks and decide, okay, what perks might benefit me? I wear glasses, so this one that offers free eyeglasses every other year, I'm gonna pick this one, you know. But the perks are your last priority in choosing, in my opinion. Okay, so those are some of the reasons somebody would choose an Advantage plan. I was getting ready to tell you, I had this lady that I worked with who was on an Advantage plan. She could not afford a supplement, but she was trying to, actually she couldn't afford a supplement, but she could probably get on Medicaid. And on Medicaid, you can stick with the original Medicare, and it supplements your Medicare, and it covers your drugs, okay? There's also Medicaid Advantage plans, special plans that these companies offer where people still get all the benefits of Medicaid, but they're on a private healthcare plan. So she wanted to switch off of that Advantage plan and go on to original Medicare and have Medicaid be her supplement. But she was using the transportation benefit from her Advantage plan regularly, routinely, to get to her doctor appointments. She had to go to the doctor every month. And her particular plan offered transportation. And at that time, it was unlimited medical transportation. I think most of the plans now do limit it to so many visits a year, but at that time, it was unlimited. And so my concern was, how is she gonna get to the doctor's office to even use her original Medicare if she doesn't have that transportation benefit? And so in the end, she decided to stick with what she had. It was covering her needs at the time. If she was not needing rehab, she was not needing any kind of services that her plan wasn't covering for her. So what's better? It depends on what your situation is as to what's better. In general, I say if you can afford to stay on original Medicare, stay on it, because once you switch to an Advantage plan, yes, you can go back to original Medicare, but remember the supplement had that window of opportunity at 65 years of age where they did not look at pre-existing health conditions. Well, now that you're trying to switch back to original Medicare when you're 78 years old, they're gonna look at your pre-existing. And the reason you're switching back usually is because your Advantage plan, your health care needs have gotten higher and your Advantage plan isn't working so well for you anymore. So you wanna go back to original Medicare, and either the supplement is not available to you or it's available to you at such an extreme cost that it's ridiculous. So once you go off of original Medicare, it is not easy to go back because of that supplement. You can't, it's allowed, but it's just not very easy to do it. And
Is it just based on your, pre-existing conditions, your current health situation, or is it also age related? My dad's 87. He takes one blood pressure pill that he says he doesn't need, but that's all. So he really does not have any major health issues, but he's 87.
Right. So all the supplements have those age categories where the premiums go up as you age. So that would have happened to you had you stayed on original Medicare, just the age part. So if he's 87 and he really has no diagnoses that are of concern to the health insurance company, get with a broker who works with all the major companies and see what can be done. It's possible you could get him on at something.
Yeah, his Advantage plan is getting discontinued, so that's why we gotta find another one.
Okay. Yeah. So definitely contact an insurance broker because they can show you Advantage plans, they can show you supplements, and you can kind of decide what will best meet his needs. Some of the agents really push the Advantage plans, so that's another warning. You might ask around because I don't know what the situation is now because I've been out of Medicare counseling for 5 or 6 years now, but there was a time when their pocketbook benefited from selling Advantage plans over the supplements. Okay, and so you have to get somebody who's ethical, and there are quite a number in our community who are very ethical and do this out of their hearts because they want to help seniors and they want to get them on something that'll best meet their needs, and they work really hard at it. But there were a few I remember that you could never get them to divert off the Advantage plans no matter what the situation was. And that's not being negative to Advantage plans, that's just saying sometimes that's not the best thing for a certain individual, and that individual has the right to know about the options, So, as I said, open enrollment is coming up later this month, and that is the time where you can make changes in your Advantage plan or your Part D. And you can only, if you have original Medicare, you can't have an Advantage plan. If you have an Advantage plan, you can't have original Medicare. If you have original Medicare, you don't have to have a supplement and you don't have to have a Part D. But if you need one, like I have neighbors down the road, they're in their 80s, and they're each on one drug, and it's not a very expensive drug, and they've never had a Part D. But the husband ended up getting diagnosed with cancer, and his drugs got really expensive, so he wanted to get on a Part D. But because he didn't enroll in Part D when he was 65, he had a penalty. So that raised his premium from what would have been an average of maybe $30 to $40 a month up to well over $100 a month. And he was enraged, just outraged over the whole thing, you know, just furious over it. But the government wants you to enroll in your Part D at age 65, because that's what keeps the whole system economically sound, is that healthy people and not so healthy people are all paying in. That way it can afford to take care of you when you're not so healthy. So if you don't enroll until you're not so healthy, well, you gotta make up for not paying for those years when you were healthy. And that's just the way the government looks at it, you know? Yes.
Okay, you said you cannot have both original and advantage plan, but then you said something else. It was about Part D.
The penalty?
Oh, that you don't have to have a Part D and you don't have to have a supplement.
Okay.
But like I said before, you do decrease the availability of healthcare when you do that, because a lot of doctors and healthcare providers, if you don't have that supplement and they know their bills are going to be high, unless you can prove you've got, you know, big resources that you can pay privately with, they're not going to accept you.
So I did a little homework last night.
Oh, you got the
I'm
Medicare
my
name.
mom's legal person,
Uh-huh.
so she has never had Part D.
Okay.
So I thought, well, let me look into that and see what it would be. Her penalty, if I did my math right, would be $90 a month.
Plus whatever the premium is.
Plus the premium.
Yeah.
And is it correct, $34 is the current, does that sound right?
That's an average.
An average.
Yeah, that's an average.
So her monthly for Part D would be $124,
Mhm.
and that's way more than what she's currently paying in medication, so.
Right. So it's not
It's
worth
not
Yeah.
worth it.
Unless she qualifies. Let's go over this extra help handout. I think I kept one. What's that? Let me look. That's that one I told you you could fold in half. Let me see if I still have it. Or if I grab one. Oh, here it is. I've got it.
Okay.
Okay, so basically there are two programs that help pay for Medicare. One is offered through Social Security, and it covers your Part D drug plan, if you qualify. The other is offered through Medicaid. Now the difference between Medicare and Medicaid is that Medicare is our government health plan that all of us, if we've worked enough quarters, can qualify for at age 65. Medicaid has income and sometimes asset qualifications. It's for people that can't afford to pay these things without help. Okay, so first of all, I'm looking at the inside of the fold out. Looking at that left-hand side, the program that covers your Part D costs, it tells you what your monthly income can be if you are an individual or if you're if you have a spouse. And there are 3 different levels of benefits under that program. The 2 and 3, I've never understood that. It looks like they do the exact same thing. I don't know why it's not just one level, but there's probably some little details that are different that just aren't discussed unless you qualify for them. Okay, so that helps with your Part D. And then you see that there are also some asset limits, okay, for that Part D. But if you look at the other side, the Medicare Savings Program, that's the part that helps you with your Part B, your deductibles, and it serves as a co-insurance, so you don't have to have a supplement. There are only income limits there, no asset limits. But if you qualify for the Medicare Savings Program, you automatically get the low income subsidy that pays for your Part D, even if you have assets. So, again, when they sat down to plan Medicare, they wanted to figure out how to make it very confusing, and they did so. But anyway, you can see here, talking about your mother, she may be able to get a Part D at no cost to her if she qualifies for that low-income subsidy program.
So who do I talk to about
Call the Caddo Council on Aging, and they will help her apply.
Disability Resource Center.
Yeah, the Aging and Disability Resource Center.
We've seen them several times. Complete confidence in them,
Mm-hmm.
complete confidence.
Yeah, no, it's an excellent program, and, those women that work in that program really know the program inside and out.
Thank you.
Okay, so, any questions about the HELP program for Medicare? If you qualify, at the highest level where you get the most benefits, you're called a qualified Medicare beneficiary. That's that top category on the right-hand side. You can do original Medicare and let the Medicaid program be your supplement, and it covers your drugs, also pays all the premiums. You can also opt for one of those Medicare Advantage plans I told you about, that, but make sure they're putting you on one of their special needs programs that is for Medicaid, the dual eligible Medicare, Medicaid. Because if you get on a regular Advantage plan, then you end up having to pay co-pays when you go to the doctor that you wouldn't have to pay if you hadn't opted out of the original Medicare. You don't, if you qualify for QMB, you shouldn't be paying co-pays when you go to the doctor. That's one of the other traits of the Medicare Advantage program, is that even though most of them are zero premium now, there are co-pays when you go to the doctor. And when you go to your general doctor, they're not exorbitant. They're, I don't know what they are now, but probably, I would guess them to be maybe $35, $40 copay. But when you go to the specialist, like if you have to see a specialist routinely, maybe an arthritis specialist or a heart doctor or something like that, those co-pays can eat up your savings of not being on original Medicare pretty quickly, because those co-pays can run $60, $70, $80, $100 easy. And if you're going to that doctor every other month or every quarter, that can add up over the year. So, but if you are on the Medicare Savings Program and you're having to pay co-pays, you need to get off of whatever plan you're on. Call the ADRC at the Caddo Council on Aging and let them help you, because the other thing that happens when you get on this program is you don't have to wait for open enrollment time each year to make a change. You can make 2 changes a year outside of the enrollment period.
But if you're on Medicare Advantage, like we have Humana,
Mm-hmm.
And you wanna go back to regular Medicare,
Mm-hmm.
they'll, request a health check.
Yes. Yeah, you'll have to get an exam. Sometimes different companies do it differently, but most of them have their own RN that they contract with or that works for them for your region, that they'll come out usually to your home even, or wherever you want to do it, and do the health assessment. It's mostly a bunch of questions, but they'll do your blood pressure, it might take a blood sample, you know. It's kind of almost like your annual doctor visit.
Yeah. So, my husband is getting, worse as time goes on.
Mm-hmm.
And so it's a possibility if we ask to go back to Medicare, he would be denied.
It's possible. Mm-hmm. It's also possible he would pay a lot for his supplement. He wouldn't be denied to go back to original Medicare, but it's that supplement, that Medigap policy, that becomes the problem. He could get back on Part A and Part B, and you know, that's okay.
Mm-hmm.
But he would have to pay that 20% unless he qualified for like some kind of program, government assistance. He would have to pay that 20%. So if he went into the hospital, he would have to pay 20% of that hospital bill if he didn't have a supplement. If he went into inpatient rehab, same thing. Like, you know, when you finish a hospital, sometimes they move you into rehab for a while.
Yeah.
He would have to pay that 20%. he would have, Medicare would cover the first 20, 21 days, I think it is, but they'd only
Mhm.
pay for 80%.
And like right now, I wanna say it's like over $400 a day at a rehab place.
We've been there.
Yeah. So if you're considering going back to original Medicare, talk to an insurance broker that works with all companies again. That's something that it requires an insurance license to do. The Advantage plans, because they are not just drug plans, they are also healthcare plans, you have to have an insurance agent. And then of course the supplements, you have to have an insurance agent. So when you get counseling, for example, at ADRC, they can even enroll you in your Part D, because that's simply a drug coverage plan, it's not a healthcare plan. But if you're working with an Advantage plan, they can talk to you about them, explain them to you, but they can't enroll you. They'll refer you to an agent that, or a choice of agents that they know are good agents that that treat seniors with respect and are not trying to just fill their own pocketbooks. You know, they'll get you to some of the good agents. So that, if you're exploring that option, that's what I would do. I would go ahead and start working with a good agent and get that agent to come up, if there's some options for you, come up with what those options are. So before you make any changes, don't make any changes until you look at what you have to change to. And then if something seems desirable, then make the change.
Would that be on the Council on Aging? Would they be there?
Well, if you're looking at going back on original Medicare, call them and ask them to refer you to an agent. Let them know what you want to do and ask them to refer you to an agent. They can, or you can make an appointment if you want. Like I said, they can talk to you about it, but they can't enroll you in a supplement because they're not licensed agents.
Okay. Yeah, my mother-in-law is thinking about going back to regular Medicare, and she goes through Council on Aging, and her person that she talks to is with Aetna, and he discourages it, you know,
Okay.
all the time. Is that
Okay.
what you're talking about?
So she got referred to an agent through the Council on Aging, is that what happened? And it's an Aetna agent? Well, make sure it's, I mean, an agent can sell Aetna who doesn't work for Aetna. He can be, like I said, a broker who has contracts with several of the major insurance companies. So if it's somebody like that, then she's probably getting appropriate advice. But if she's only dealing with Aetna as a company, then she probably needs to talk to another agent who has information about more than one company. Does that make sense?
Yeah.
Okay. And sometimes it's not a good idea to go back, you know, so I mean that is true. Sometimes it depends on the individual situation, but sometimes it's not a good idea to go back.
I know.
When you go on, if you have to go on hospice, again, like I said initially, that's a different situation. And sometimes when you go in a nursing home, particularly if you get on long-term care Medicaid to cover your nursing home, some nursing homes are going to encourage you to go back to original Medicare. I think that's less and less the case because the Advantage plans have gotten more providers enlisted with them now than they did when they first came to the area, so that's probably less and less the situation. But it could still happen, particularly in some of the rural areas where there's not as much availability of Advantage plans.
So the licensed insurance agent can enroll you in a supplement or an Advantage plan,
Correct.
and you don't need them for Part D, cause that's drug plan.
A lot of them will go ahead and do Part D for you, or some of them will refer you to the Council on Aging for that, cause they don't wanna take the time to do it and they know that you can get it done for free. But some of them will go ahead and do it just because they're doing your other plan. You know, they'll do the whole package for you. And actually, I said that, but part of the reason they might refer to the Council on Aging isn't just because they don't want to take the time to do it. It's because they work closely perhaps with the Council on Aging, and they know that, that the funding, for those programs, you have to turn in reports and numbers matter. So if you've enrolled a huge number of Part Ds, they're gonna refund that program for next year. But if the insurance agents have kind of taken over that for the most part and not many people go to the Council on Aging, they're gonna lessen funding for that program. So that's another reason they do it, is they realize it's a valuable service and they don't want it to lose funding.
Anybody have any other questions? Alright.
Did I cover everything you wanted to hear? Anybody?
Yes.
Okay.
I have a quick question. So on the supplement, my mom does have a supplement and
Mhm.
she's had the same one forever, from what I can tell.
Mhm.
Would it be beneficial to look for another supplement that's gonna be a little bit less expensive, or do you still have to go through the?
You have to go through, and unless you're, usually people don't change supplements
Okay.
like they do Part Ds. But if you wanna change plans with the same company, like, there are different plans. The Part G I mentioned is the plan that is still available today that covers just about everything. The only thing it doesn't cover is that Medicare deductible. And I think I gave you a sheet that goes over what you pay, and it has the Medicare deductible for this year on it, the 2024 premiums, deductibles, and co-insurances.
We didn't get that one.
Oh, you didn't get it, okay. Now you have it. So it'll change in 2025, and most of these figures on these sheets that I've handed out to you, I looked and they don't have the 2025 available yet, but if you go to the SHIP website, when they become available, you can pull them for yourself and look at the changes. But the G, the Plan G, and again, they're the same from company to company to company, covers everything that Medicare covers. It covers the difference except for that deductible, okay? So once you pay your deductible, you're home free for the rest of the year, and there's a new deductible, of course, every year, every plan year. So that's the most all-inclusive, and it's also the most expensive. But there are other plans that, where you pay a little bit more than just the deductible, and it depends on the plan, and again, they're all government prescribed, okay? So you might wanna explore with the agent, staying on with, because sometimes when you stay with the same company, they don't implement all those they don't have those pre-existing condition situations. They'll probably still do the health assessment, but they'll allow you to more easily slide into a different, one of their plans that they offer, without making it so that it's too costly to do so.
My wife is diabetic,
Okay,
and she's on an insulin pump and a Dexcom glucose monitor.
mhm,
We just recently made some changes in suppliers, and company now is telling me that that's all covered under Part A of Medicare, which
Okay.
doesn't sound right to me. Is that correct or not?
I don't know, cause I know there have been some very recent changes in, funding for diabetes medications. So, I can do a little more research on that. I mean, just kind of like logically, no, it doesn't make sense. But since I'm not familiar with these changes, other than you can get, diabetes drugs much less expensively than you used to be able to get them for, they actually are it's possible to live with diabetes and not go broke. I don't know where that money came from exactly, but I can look into it.
Well, I know with the, with the previous supplier we were using,
Mhm.
we would usually get an order for a first quarter early in the year, and we would have to pay a deductible.
Mhm.
But after that, through the rest of the 3 quarters,
Mhm.
we didn't pay anything.
Right, and most Part Ds work that way.
Now, we're going to a local pharmacy, and I just picked up a sensor for her the other day, and I had to pay $50. Which,
Why did you change pharmacies?
well, the company I was using was one of the national mail order deals, and I was getting irritated with the way they were doing business.
Okay, okay.
So, and then I found out from the doctor that we could get them locally now, so I just figured that was a better option.
Okay,
But if I'm gonna have to pay, you know,
right.
kind of money for every sensor I get,
Well,
go back.
during open enrollment, I suggest you take a look at things again for your wife. And, you know, I'm leaning towards thinking, well, there might, since Part A is inpatient stuff, I'm really surprised at that. If you'd have said Part B, it would've been more palatable. But I'm not saying, because I don't know, I don't wanna say for sure, but I would definitely review my Part D, yours and your wife's for that matter, to make sure that, cause I know there are probably some medications involved also, and, I would review Part D every year.
What I have found is my husband is on, well, both of us are on tier 3 and 4 drugs.
Mhm.
And you know that little tiny piece of paper that comes in the bottle that you unfold and it's this big?
Yes, yeah.
It's a waste of paper.
Yeah, the down at the bottom, at the very, most of them have, for the drugs, I don't know about sensor things, but
They have
most
to.
of them have a phone number for patient assistance.
True.
And
True.
you send in all your, well, they have the website that you can get the application and the phone number
Mhm.
that you can call. And we've had success with that.
Yeah. That's a very good point. You can get, assistance paying for drugs directly from the drug companies, with almost any expensive medication.
Mhm.
I know that people on, cancer treatment drugs very often, end up doing it. Sometimes the physician helps them do it. And what you do is exactly what she said. You contact the drug company itself, or you go on their website and you get the forms to fill out, and it asks information about your finances. And the qualifications are usually not that strict because the drugs are so terribly expensive that even middle class people probably can't afford them for very long. And you can get on a program, and you have to renew it usually, sometimes annually, sometimes every 2 years. It depends on, the application will explain everything to you. So you have to send updated information to them to remain on it, and the doctor has to participate in it. But she's right, that's my neighbors I was telling you about, the guy who gripes so much about his cancer treatment drugs. That's what he ended up doing, was contacting the drug company and getting them for free. Getting them for free.
Wow.
That's what my dad did before he passed away. He was put on Aliquis and with
Yeah.
no insurance. That
Yeah.
was like through the roof.
Yeah, nobody can do that. Yeah, so that's a very good point, thank you for bringing that up.
I tried to get some information from Medicare last week, and after getting transferred to 2 or 3 different people and getting conflicting answers.
Gotta have council on aging.
Yeah, call
Yeah,
the
I'm
council on
calling
aging.
them.
Yeah, 676, 7900.
Yep.
I'm sorry, 676.
7,900.
And you don't need to remember ADRC or Aging and Disability Resource Center, just say, I need help with my Medicare.
There you go.
All right, well, thank you so much, Bridget, this has been
My
wonderful.
pleasure.